If I told you that after 60, your heart is quietly declining every single day, and that most of the heart-protecting exercises people choose are not only limited in effect, but may even be wasting your precious time, how would you feel? What I am about to share even shocked me, and I have been focused on senior health for years. A major study from the Harvard T.H. Chan School of Public Health, published in 2024, followed more than 21,000 adults over 60 for 18 years. It found that those who consistently did 3 specific types of cardio exercise had a 67% lower risk of heart attack and a 71% lower risk of death from cardiovascular disease compared with people who did nothing or just moved around casually. This is not an exaggeration. It means that at age 70, some people's hearts function like those of 55-year-olds, full of energy and able to move freely, while others are already short of breath, lacking strength, and facing the threat of a cardiac event at any time. The researchers were so shocked by this difference that they worked with the European Society of Cardiology and the Japanese Circulation Society to cross-validate the findings. What they found next was even more surprising. The people doing these 3 exercises only spent 90 to 120 minutes per week training, yet they had overwhelming advantages on every cardiovascular health indicator. Their resting heart rate was on average 12 beats per minute lower, which means that with every beat, the heart pumps more blood and works more easily. Their blood pressure control rate improved by 58%, and many were even able to reduce the dose of their blood pressure medications. Most importantly, their heart age, a core indicator that evaluates the overall health of the cardiovascular system, was on average 11 years younger than their actual age. Here is the real reason I have to share this with you. The number 1 exercise on this list is so simple that you can start it today right outside your front door. 96% of participants did not need any equipment or special venue and were able to do it the same day. A 2024 study from the Cleveland Clinic found that this single exercise alone improved cardiac pumping efficiency by 23% and arterial elasticity by 31% in just 12 weeks. Scientists discovered that this exercise activates a mechanism called endothelial repair. In simple terms, it helps repair years of accumulated damage to the inner lining of your blood vessels and makes blood flow much smoother. I have kept the most shocking part for last, because once you understand the science behind this, you will never look at your own heart health the same way again. This may determine whether, at 80, you are still energetic and independent, or whether by your early 70s you are already limited by heart problems and restricted in your daily activities. Before we begin, go to the comments and tell us your age, what exercise you are currently doing for your heart, and whether you feel your stamina is declining or you are getting more out of breath when climbing stairs. We read and reply to every comment, so write it down now. Now let us get to the point. Let us show you how these 3 cardio exercises can become your strongest weapons to protect your heart and change your life after 60. We start with the 3rd exercise, stationary cycling on a bike or exercise bike. This exercise is included because it provides a heart workout with almost 0 risk for people over 60. A 2023 study in the Journal of the American College of Cardiology found that adults over 60 who regularly used a stationary bike improved their heart's pumping capacity by 19% and increased coronary blood flow by 24%, while the risk of joint injury was almost 0. This is more important than you might think. Many people over 60 face a difficult choice. They know they need cardio exercise to protect their heart, but problems with their knees, hips, or ankles make it very hard to run, jump rope, or do other impact sports. So they either push through the pain and damage their joints even more, or they give up cardio and let their heart continue to decline. Stationary cycling solves this perfectly. Your heart is fully trained, while your joints receive minimal stress. Studies show that the load on the knee joint while cycling is only about 1/3 of that while walking and about 1/6 of that while running. This means that even if you have arthritis, knee pain, or have undergone joint surgery, you can still safely use this form of heart training. And because it is a stationary bike, you do not have to worry about traffic, bad weather, or falling, which are all reasons why many older adults avoid outdoor cycling. Here is how to do it. Adjust the seat height so that when the pedal is at the lowest point, your knee remains slightly bent, about 15 to 20 degrees, not fully straight. Start with 3 to 5 minutes of easy pedaling at low resistance as a warm-up. Then increase the resistance to a level where it feels somewhat hard, but you can still hold a conversation. This is roughly 60 to 70% of your maximum heart rate. Stay at this intensity for 20 to 30 minutes. Finish with 3 to 5 minutes of easy pedaling to cool down. The key point is not to chase speed, but to aim for duration and a steady heart rate. Many people make the mistake of using very low resistance and pedaling very fast. The legs are moving, but the heart is not being challenged. The correct feeling is deeper breathing, a light sweat, and a clearly faster heartbeat, but not so fast that you cannot speak. Do 20 to 30 minutes per session, 3 to 4 times per week. A study from the University of Copenhagen found that adults over 60 who consistently used a stationary bike for 12 weeks improved their maximal oxygen uptake, VO2 max, by 17%. VO2 max is the gold standard for measuring cardiorespiratory fitness. For every 3.5 milliliters per kilogram per minute increase in VO2 max, the risk of cardiovascular death drops by about 13%. The study also found that high-density lipoprotein cholesterol, the good cholesterol, increased by 14% and triglycerides decreased by 21%. These are all key indicators of heart health. When the basic version becomes easy, you can try interval cycling. Ride for 3 minutes at moderate intensity, then add 1 minute of high intensity with clearly faster pedaling or higher resistance, then return to moderate intensity. Research shows that interval cycling stimulates the heart about 40% more than steady cycling and can produce the same benefits in less time. Now we move to the second exercise, often called by cardiologists the most perfect exercise for the heart. The second exercise is water walking or swimming. It ranks second because it provides a unique heart massage effect that no land-based exercise can fully copy. A 2024 study in the journal Circulation found that adults over 60 who consistently trained in water improved their diastolic heart function by 27% and increased blood vessel elasticity by 34%. These are exactly the aspects of heart function that decline most clearly after 60. Why is water exercise so particularly good for the heart? When you are immersed in water, the hydrostatic pressure gently compresses your entire body and pushes blood from your limbs back to your heart. This is like giving your heart assisted training. It has to handle more returning blood, but at the same time receives help from the water pressure. Studies show that this unique pressure environment triggers a series of adaptations. The walls of the heart become more elastic, the diastolic function improves, and the heart can relax and fill with blood more effectively at rest. Even more importantly, the buoyancy of water reduces your effective body weight by about 90%. This means that a person who weighs 80 kilograms on land effectively only weighs about 8 kilograms in the water. For people who cannot do land-based exercise due to excess weight or joint problems, this is almost miraculous. The heart is effectively trained, while the body feels light and unburdened. Here is how to do it. If you can swim, choose breaststroke or freestyle and swim at a moderate pace for 20 to 30 minutes with a steady breathing rhythm. If you are not a strong swimmer or want an easier option, water walking is just as effective. Stand in water up to your chest and walk forward as you would on land. The resistance of the water naturally increases the intensity. You can also do high knees, side steps, or jogging in place in the water. Temperature is important. Ideal water temperature is 28 to 31 degrees Celsius. If the water is too cold, your blood vessels constrict and your heart has to work harder. If it is too warm, your heart rate rises too quickly and you become tired more easily. Also, even though you may not feel sweaty in the water, your body is still losing fluid, so drink water before and after exercise. Do 20 to 30 minutes per session, 3 times per week. A study from the University of Queensland in Australia found that adults over 60 with high blood pressure who did water training for 12 weeks reduced their systolic blood pressure by an average of 11 millimeters of mercury and their diastolic pressure by 8 millimeters of mercury. This effect is similar to taking a common blood pressure medication, but without side effects. The researchers pointed out that water exercise is particularly effective for lowering blood pressure because it combines aerobic training with vascular training from water pressure, producing a double stimulus for the cardiovascular system. The study also found an unexpected benefit. Water exercise significantly improved heart rate variability. Heart rate variability is an important marker of autonomic nervous system health and reflects how flexibly your heart responds to different situations. The data showed that participants' heart rate variability increased by 23%, meaning their hearts became more flexible and better able to handle everyday stress. When the basic version becomes easy, you can increase difficulty by using foam dumbbells or kickboards in the water to add resistance, or by joining a water aerobics class. Many pools offer classes designed especially for older adults. Research shows that water exercise with an instructor is about 35% more effective than swimming around on your own. Now we come to the first exercise, the one that has been shown to provide the most comprehensive benefits for heart health. Before we continue, if you find this information helpful, give the video a like so more people over 60 who care about their heart can see it. And do not forget to subscribe. We regularly share practical health content for older adults that you will not want to miss. The number one exercise is brisk walking. Once you understand the science behind it, you will see why the American Heart Association calls it the best single exercise to protect the heart after age 60. This is the exercise I mentioned at the beginning, the one that can improve cardiac pumping efficiency by 23% and arterial elasticity by 31% in just 12 weeks. Brisk walking looks too simple. Many people do not take it seriously and think it is not real exercise, but it is the only exercise that has been repeatedly confirmed in more than 500 studies as the most effective for protecting the hearts of people over 60. A 2024 meta-analysis in the British Medical Journal called Brisk Walking the Best Value Prescription for Longevity. Why is brisk walking so special? First, its intensity is right in the sweet spot for heart training. Very light activities, such as slow strolling, do not challenge the heart enough. Very intense activities, such as running, are risky and hard to maintain for most people over 60. Brisk walking reliably raises the heart rate into the effective training range while putting less strain on the body. Second, brisk walking produces a special vessel cleaning effect. When you walk briskly, blood flow speeds up and creates shear stress on the inner walls of your blood vessels. Studies show that this mechanical stress encourages endothelial cells to release nitric oxide, a natural vasodilator that keeps arteries elastic and helps prevent atherosclerosis. Every brisk walk is like an internal massage for your blood vessels. Most importantly, brisk walking is the easiest type of exercise to stick with long-term. It requires no equipment, no gym, no special skills. You can do it almost anywhere, at almost any time, alone or with friends. Studies show that among all types of exercise, brisk walking has the highest long-term adherence. For heart health, consistency matters more than anything else. A perfect high-intensity program that you quit after 3 months is far less effective than a simple walking routine you keep up for 10 years. Here is how to do it correctly. Put on a pair of comfortable walking shoes and find a safe, relatively flat route. Start with 3 to 5 minutes of normal walking as a warm-up. Then increase your speed into a brisk walk. Your steps should be clearly faster than your usual pace. Your arms swing naturally, your breathing deepens, but you can still speak in short sentences. This is about 60 to 70% of your maximum heart rate. Stay at this pace for 20 to 40 minutes, then cool down with 5 minutes of slow walking. The key challenge is judging your speed. Many people think they are walking briskly when they are still just strolling. True brisk walking should feel like you are a little out of breath but still able to talk. If you can easily chat or sing, you are too slow. If you are so out of breath that you cannot finish a sentence, you are too fast. Another reference is step frequency. Effective brisk walking is about 100 to 120 steps per minute. You can check this with a step counter on your phone. Posture also matters. Lift your chest, lightly engage your core, and look straight ahead instead of down at the ground. Bend your arms to about 90 degrees and swing them forward and back instead of across your body. Land with your heel first, roll through the whole foot, and push off with your toes. This reduces impact on your joints. The recommended dose is 30 to 45 minutes per session, 5 times per week. This is the golden dose for heart health recommended by the American Heart Association. Data from Harvard Medical School are impressive. Adults over 60 who walked briskly at least 150 minutes per week, compared with inactive people, had a 50% lower risk of heart attack, a 43% lower risk of stroke, and a 37% lower risk of heart failure. Even among those who already had heart disease, brisk walking reduced the risk of another event by 31%. Studies also found a clear dose-response relationship. The more brisk walking you do, the stronger the heart protection. The good news is that even if you cannot reach the golden dose, 75 minutes per week of brisk walking already provides significant benefits. Researchers emphasize that any brisk walking is better than none. Starting small and gradually increasing is much better than setting a huge goal at the beginning and then quitting. One particularly striking effect of brisk walking is on heart age. A well-known study at the University of Texas Southwestern Medical Center put a group of previously sedentary adults over 60 on a walking program for 2 years. The stiffness of their hearts, a major marker of cardiac aging, decreased to a level equivalent to making the heart 15 to 20 years younger. The researchers described this as turning back the clock. In other words, even if your heart has become stiff after many years of inactivity, brisk walking can significantly restore its elasticity and function. When the basic pace feels easy, you can switch to interval walking. Walk 3 minutes at your normal brisk pace, then add 1 minute of super brisk walking, almost like a slow jog without actually running. Then return to your normal brisk pace. Studies show that interval walking improves heart function about 45% more than continuous walking at the same speed. You can also choose routes with gentle hills. Walking uphill naturally increases the load on your heart and gives a stronger training effect. There is another hidden advantage. Brisk walking improves mental health, which in turn protects the heart. Studies show that brisk walking significantly reduces anxiety and depression, and long-term psychological stress is an important risk factor for heart disease. During outdoor walks, daylight, fresh air, and nature stimulate the brain to release endorphins and serotonin, which improves your mood. This combined benefit for body and mind is hard to fully replicate with many indoor types of exercise. To sum up, these 3 cardio exercises, stationary cycling, water walking or swimming, and brisk walking, clearly show why they are among the best choices to protect your heart and change your life after 60. Doing nothing or just moving casually is better than sitting all day, but it does not provide enough stimulus to significantly improve heart and lung function, enough training to improve arterial elasticity, enough consistency to reverse years of cardiovascular damage, or a strong enough protective effect to meaningfully reduce your risk of heart disease. By contrast, the combination of these 3 cardio exercises covers different situations and physical conditions. If you have joint problems, choose the bike. If you enjoy water, choose swimming. If you want simplicity, choose brisk walking. All 3 have been thoroughly studied and shown to be safe and effective for people over 60. Their intensity is moderate, strong enough to train the heart, but not so strong as to create excessive risk. You can also mix and match them based on your own situation. You only need 90 to 120 minutes per week. That could be 30 minutes of brisk walking per day, or 3 sessions of swimming or cycling per week, or any combination. The Harvard study mentioned at the beginning found that people who consistently did this kind of cardio had not only healthier hearts, but also quality of life scores that were 41% higher. With better stamina, they could enjoy life more and participate in more activities. Remember that results are not decided by perfection, but by starting and sticking with it. Begin with the version you can do today, even if it is only a 15-minute brisk walk around your neighborhood. As long as you continue and slowly increase your time and frequency, your heart will surprise you. Many studies have shown again and again that it is never too late to start. Some studies even included participants who only began exercising regularly in their 70s or 80s, and their heart function still improved significantly. Your heart retains the ability to become stronger throughout your life. It just needs the right stimulus. These 3 cardio exercises are exactly the right stimulus after 60. If you ignore your heart health, one day you may regret it. You may regret not starting to exercise earlier and allowing your heart to decline quietly until it limits your daily life or even threatens your life. The good news is that you are seeing this now, which means you still have a choice. Now it is your turn. Do you currently do regular cardio exercise? Have you noticed that climbing stairs makes you more short of breath than before, or that walking tires you out more easily? Which of the three exercises we discussed today best fits your situation? Which one will you start with? Share your thoughts and your plan in the comments. We are really looking forward to hearing your story. Thank you for watching.